What's up, you guys? It's your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering the workflow in the world of radiology. We're going to be covering the main radiology, the emergency room, the floors, the patient, outpatients. We'll be covering all in today's video. So to give you context, I am a night shift tech, Xray tech. I've been doing it for over 4 years now. Trauma 3 ER. In the great state of Texas. So, I guess we'll start with the main radiology department. For those who do not know, you deal a lot of fluoroscopy and you do some few x-rays, but it's mainly all the fluoroscopy. The enemas, for those who do not know, is when you put contrast, air, and other stuff of people's rectum. And you have esophagograms where essentially they're drinking contrast, barium, and stuff like that. And they assess for what's going on in the esophagus. That's what's called esophagogram. And you have the small bowel studies that usually happen up there. You have like the hip injections with some lidocaines or arthrograms, cystograms. The other one that the ladies get, starts with the H. I can't remember it right now on top of my head, but essentially you have all that. Essentially, if you work at the main, usually you work the typical 8 to 4, 8 to 5-ish, depending on your hospital. That's the main radiology. Now, if you're in level 1 or level 2 trauma, the main, they do fluoroscopy. They can do it overnight. They can do it during the daytime. They work a little different compared to like my hospital. That the main X-ray techs at the main is usually an 8 to 5, 8 to 4:30, depending on what's going on, type of gig, Monday through Friday. Majority of the times, the X-ray techs who hold it down over there are the more veteran techs, or more of the techs who enjoy or do better in like the fluoroscopy, or who've been there a long time. Most of the veteran techs kind of hold that slot down because they kind of know how the radiologist / RPA likes to deal with their stuff. But anyways, you're here to know about the workflow. Essentially, you have certain people, as far as patients, that are scheduled by doctors, by maybe the ER, by maybe whoever's on the floor, nurse practitioners, or whoever, right, is ordering stuff. They schedule exams or swallow studies and stuff. Depending on what floor, certain stuff are more common. Essentially, they have a set amount of slots. Some are like 30 minutes, some are 40 minutes. It all kind of depends on what kind of exams they're dealing with. So essentially, you have kind of a block little window. In some places, they have like a little, what's it called? Like they have like the scheduled, the 1 hour break in the middle from like, I want to say from 12 to 1, it's closed. They close down for lunch and stuff like that. Or it's 30 minutes or an hour. I can't remember off the top of my brain. But essentially, they'll close down during that time. And then mainly in the afternoon, or if there's anything stat on the floor that hasn't been like scheduled, they'll kind of squeeze them in depending on the priority and depending, because usually at ours we have 2 different rooms. They have 2 stuff going on depending, because I know certain days maybe the speech pathologist is only available for certain days or whatever they have going on, and they have to kind of work around that. Certain days like Monday are more heavy on fluoroscopy. And then you have all the regular people who aren't like admitted. They're just like the walkie-talkies who come in because they have scheduled appointments, and those also get trickled into like they have certain slots available for them. I know on the holidays they don't work and it is closed. On the weekends, we don't take at our hospital like people who just come in scheduled. This is closed off. They may do certain exams. Certain of the weekend techs may have to get involved depending on what's going on. For the most part, I'll see maybe a swallow, like a small bowel, or sometimes there's some other stuff. Like the RPA will call up at our hospital and asking what we have, if anything's stat, and they'll kind of assess whether or not they have to come in to kind of knock that out. For the most part, they're working with the RPA, at least at our hospital, and sometimes the radiologist, depending on what's going on. Now, if that's your gig, you're more than welcome to go over there. As far as, that's like the main bulk of the knowledge on that. You can I can probably get in more details, but I'm just giving you like the rough outline. If we transition over to the emergency room, that's a little different. The emergency room, the workflow and how that operates, you would think it would be random because, emergency room, you never know what's gonna happen. People are doing stuff, they get hurt. But in some part, it kind of has its own little structure in their own kind of little way. So over there, it is some techs at our place, it's supposed to be an 8 to 8 gig, but they kind of trickle in depending on how they scatter into the workflow. Some places they have, we have one tech that gets here at 7:30. We have another tech that gets here at 8. Other one at 8:30. They have another one that comes in around 11. They have different shifts available, and they kind of trickle in. But for the most part, it's an 8 to 8 gig. 7 days a week that the emergency room is open. Holidays, depending on how you feel about those, if you work, you will have to work, at least at ours, like 2 major holidays and 2 minor holidays. If you're a full-time tech, you'll get involved with that. Essentially, you're shooting people who come down from the emergency room, who walk in, or who are brought by ambulances or from the firefighters or whatever, and you just kind of knock out stuff. Like, it'll just be, a lot of it's chest and then whatever other stuff people got going on. During the daytime, depending on the type of year we're in, the workload can vary. Obviously, there's more people working in the daytime. Like at our establishment, we range from 3 on the weekend to 4 to 5 during the weekday. And at night, there's dose. Regardless of when you go, at our establishment, it is 2. So, at our place, you hold down the emergency room and the floors, whatever's happening on the floor. Certain places, there's Xray techs who literally just stay in the emergency room maybe at the bigger places or whatever, or maybe they just focus in the emergency room and they don't deal with the people on the floors. Mainly it's chest, some KUB. Sometimes you have to do if they fall on the floor, you may get involved over there. But for the most part, depending on what day it is and what's going on in your city, sometimes it's just a bunch of old people falling in the morning, or in the morning it could be a bunch of MVCs, people trying to go to work, getting hurt, whatever, or the lunchtime rush where people think on their lunch break they can come in and get seen real quick for something and then go back. I've seen it before. You think, how can you squeeze something in an hour, 30 minutes? Sometimes, no, it's crazy. Because there'll be people who be like, oh, I'm on my lunch break. And I'm like, your shit broke. I don't know if you're going to be discharged or whatever's going on. And you're like, But anyways, you have people going, your city will get a lot of traffic during lunch, accidents or whatever happen. It ruins your lunch. As far as lunch, There's no structured, at least at our establishment, of when lunch. Lunch, in an ideal world, me who's worked overtime, it would be about 12 to 1. There's been times where stuff gets chaotic. I've eaten at 11. There's times stuff gets really, really bad. I've eaten all the way to 4, 5 o'clock in the afternoon because it's so busy. It all kind of depends on what's going on. Other times it'll be like chill and everyone's on lunch at the same time. Other times it's the only one tech at lunch at a time and they just kind of trickle as far as swapping and stuff like that. And then other times there is no lunch break because the hospital just never stops ordering stuff. And it's just a constant little cycle. Now, if you work nighttime like I do, it's a little bit different. Like right now, let me see, 1, 2, 3. We have 3 EMSs. So I'm gonna walk in. It could be better, it could be no EMSs, but it's all some EMS, so it's gonna be a little bit of work. Depending on the emergency room, how full it is. From here, we don't see that many people, so maybe it's not that bad, you know. But essentially, I'll come in, and we have to do the morning ports around midnight. That's extra work that I have to do that the daytime people don't. So that's a little bundle of randomness of exams that we have to do. The daytime people don't get involved with that. They're just doing their rounds upstairs. So essentially, during the daytime for the people on the floor, we have 2 floors, a west side and an east side. Essentially, they'll order chest, KUBs, NG tubes, pre-op, whatever they have going on, pacemaker. And throughout the day, amongst your schedule, whenever you can, usually 1 to 2 techs will go up to the floor. Sometimes they'll call you from the floor to go shoot exams, maybe patient's coding or whatever, and you'll just kind of be like, yo, I'm gonna head upstairs, hold it down. Or sometimes it will be like, you have to tell them they gotta wait. We're busy. Everyone's like, will literally be in traumas, coding, and it gets chaotic to the point where they start calling overhead and it can be a cluster. So during nights, it's pretty chill for the most part. We stay in the emergency room till like 2 a.m. and in a perfect world, we'll go shoot morning ports on the west side, which is like the ICU and more intense people. And then about 4 o'clock in the morning, we'll shoot the other side, which is more of the people who are alert, maybe like the neuro / like cardiology or pre-op people or post-op people. We'll shoot over there in the in the morning. And then we deal with a little bit of add-ons, but that's really about it. And then if we switch over, transitioning to like the outpatient at our establishment, that is a 8 to 5 establishment. That's 8 to 5, 8 to 4:30. We have 2 techs who run the joint over there. Essentially, we got 2 rooms with 2 tables and a wall bucky, and essentially it's people who maybe they've seen their PCP or they have an order. Sometimes we have them scheduled down and you can kind of get an idea of, okay, we have these X amount of people are scheduled for certain exams, and you can kind of look. Other time it's a walk-in clinic, so people walk in with their orders and you just kind of shoot them as they come. A lot of the times, a lot of the people go and see their physicians about between 8 all the way to 11, and then they end up coming over here, and your lunch will probably, you either take an early lunch or you take an afternoon lunch, because in the middle of that time, that's when I've noticed a bunch of work, like people come in or getting labs, getting X-rays after their primary visit care. So that can range from a skeletal survey, that can range from a basic chest one view, a pre-op, two view chest x-rays, from spines, from C-spines, flexion and extension. You get to do bilateral knees, you have like sunrises on knees, you get all the extra little things that surgeons, orthopedics, or whoever they're the problem the NPC person has, and you have to deal with whatever's going on over there. That establishment is a Monday through Friday, closed on the holidays. They really don't do fluoroscopy over there. I think our equipment is too shitty and they can't do it over there. So they have to come down to the main if they're going to have to get any stuff like that done. And that kind of summarizes all you got. So depending on what you want, like our hospital, the daytime people, depending on the tech they are and how long they've been there and how they work, I've noticed that they all kind of rotate between like the main patient outbuilding, the emergency room, and they just kind of go in little cycles. Me, who's a night shift Xray tech, I'm only in the emergency room. Even when I pick up overtime, I'm still in the daytime, only in the emergency room because that's what I do. And I go shoot people on the floor. That's where I've literally mastered my craft. So like our manager only puts us there if we pick up. So for me, that's fine. It's nothing hard. It's the same thing in the day and night. It's just a little different. At least I get paid more money to deal with the daytime activities. But if you're still here, I appreciate you. You can check out my other videos. I have memes in the link below, or check out the shorts. And we'll see you on the next one.